Hi, my name is Nairi and I'm back to make you another fostering video today. I've already covered a few things in previous videos which you might like to take a look at, but today it's all about the children first coming to you and how you make that decision on, what age range it is that you would like to take and what type of fostering. So let me give you a few ideas about the way that we were seeing it before we went through the assessment process and actually the reality of how things really work out. So in the beginning, we were looking to take on a long-term placement. We felt that we would be better if we had less disruption in the family and a child came in and stayed with us, for most of their childhood. But in reality, as a new foster carer, you are probably not going to have the experience sometimes to do that. So we were steered away from that, and there was discussion about either emergency placements, respite, short-term foster care rather than long-term foster care. Now, whether that was just us or not, I don't know, and whether you would be able to take on a long-term child, I'm not sure. So the different types of fostering that you can do are an emergency placement is where you don't have any notice. It's quite exciting actually, but it's not for everybody. So you could get a phone call in the middle of the night and a child could be brought to you in an emergency. They tend to be shorter than the other placements in the sense that the child just needs to go somewhere for a day, 2 days, maybe 3 days, and then another foster placement might be being looked for to move them on. It could be that you then keep them, but generally speaking, it might well be that another placement is looked for. Then there's the short-term fostering, which, don't be deceived, it's not particularly short term. So we were doing short term fostering, but actually most of our children stayed for at least 2 years. So it could be that it is short term and the child moves on quite quickly, particularly if it's a baby, might move on to adoption quite quickly. But short term doesn't necessarily mean short term, it just means it's time limited. So you could still actually have them for quite a while. Then you have your respite situation. We were asked if we would consider to do that first to sort of tip our toes in the water, but we didn't want the disruption of having children coming and going at weekends because we still had our adult children living at home and our youngest child was still only 14. So we said no to respite, but lots of new foster carers do go for respite, and respite is to support other foster carers to have a break. So it's a really worthwhile thing to do. So that's respite. And then we were maybe ending up looking to do the more complex end of the children. So although we didn't start off at that high end, we went into it quite quickly where we were going to be doing the complex children coming in. And also there is another type of fostering, which is mother and baby placement units, where the mother is assessed with the baby, looking at her skills with that baby in the home. So the foster carer is working with the mother who is working with the baby, if that makes sense. And there is a lot of report writing in that. So it's very intense for, say, the 12 weeks that you have them with you, and then a report is written for court. And that's a completely different type of fostering. So I think those are probably the main types. So what we did when we were thinking about, what is right for us, is we looked at the age of our own children. I think that's really, really crucial. Sometimes even though you specify that you don't want children to be near to your children's age, the desperation of finding a child a placement will sometimes, wiggle it around a little bit, and you do have to be really firm, if you don't want to receive a placement that you think is putting your own family at risk. So we had, youngest was 14. My strength particularly, but also my husband's really, is early years because that's what my career has been. So I'm much more comfortable with younger children. So we started off saying 0 to 8s because we didn't want to tie it down too narrowly. I think if you're really specific and say, oh, well, I only want the under 2s, then you really are limiting what they can do and what they can give you. I mean, if that's really what you want to do, then you might have to wait for a placement for a while. But sometimes, obviously, there are situations where it's not just going to be one. So that's the other thing that you need to consider is, are you happy to take one or two children? Are you happy to take one, or are you happy to take a sibling group? And that will end up being in your assessment. So you cannot take a sibling group of 3 on if that is not allowed for in your assessment. So you need to think about what capacity you have, not only in your home but in your hearts as well. So you need to consider how many children that you're excuse me, able to take, and that is worked through with a social worker, and that is all agreed, and it's all written down in a document saying what types of fostering you're going to go to, whether it be which can be more than one thing: emergency, respite, short term. In some cases it might be long term, mother and baby, and you might have a variety of those in there, and what age child or children you can take, and what capacity you have, whether it be 1, 2, 3, 4, however many. Okay, so hopefully that's just a bit of a lowdown on panel. Sorry, not panel, sorry, the children coming into you. If you enjoy my videos and you're finding them useful and informative, then maybe you could consider subscribing, and you will find lots more interesting things about fostering, adoption I cover, children, challenging behaviour, and lots more. So I really hope you've enjoyed this video, and look forward to seeing you again soon. Goodbye.